Hello, I'm Dr. Ali Mears. Firstly, I just want to tell you that you're not alone. We see lots of people who express these concerns. And it can be difficult, whatever your age, to discuss your sex life with somebody else. You might be worried about their response, or you might be worried about how to tell someone and what words to use. So let's look first at talking to your GP about sex, whatever your age. Now, I think over the last 20 years, sexual health and testing for sexual infections has become a lot more mainstream, and a lot more is now done in primary care, so with GPs, by the doctors and by the nurses. But I'm not sure that has helped people discuss their sex life. You may be happy going and having, or feel more comfortable having tests for sexual infections, but you may not find it that easy to go and actually talk about your sex life and the problems that you're experiencing. So some people do feel embarrassed about discussing these issues. They may be unsure what words to use, maybe worried they get the terminology wrong, or they may use words or phrases like "I can't get a hard on" and be worried that that might actually embarrass or upset the doctor. It's easy for me and my colleagues in sexual health because we talk about sex all day, every day. But lots of other doctors and nurses don't do that, and some studies have shown that healthcare workers might avoid actually talking to patients about sex. And there was a study in cancer care that showed that doctors and nurses were more likely to talk to men about their problems, male patients, than women. So just to digress why that might be, could be many reasons, but on a more medical note, there are quite a lot of medical treatments out there for helping men with their sexual problems and less so for women. So it may be that the doctors and nurses feel more comfortable discussing it when there's a medical answer. And us doctors don't really like being out of our comfort zone, discussing things that we're not too sure about what to do or how to manage the situation. Now, while I understand this anxiety that us doctors can have, I'm not sure it's that well founded, and when I teach doctors and nurses about talking about sexual function and sexual health, I get them to just stop and think about what actually the patient would like and what the patient needs in that setting. And I think what you would like is that you get listened to, that you have your concerns taken seriously and acknowledged, and actually you're not looking for an answer there and then. You don't want your problem solved in 1 minute, but you do want a doctor who's compassionate, who can talk to you and then maybe signpost you elsewhere or give you some advice. They may be able to manage the problem themselves, but often if they need to hand you over to another doctor, that's fine. Now, on a more medical note, it's really important to think about sexual function, because often there can be an underlying medical condition or something important associated with that symptom. So, for example, a lot of sexual problems can be linked with depression in both men and women and anxiety. For example, with erectile problems, this can be linked with underlying what we would call silent heart disease. So if you look at a number of men who've had heart attacks, then quite a few of them 3 to 5 years before the heart attack develop problems with their erections. The same goes people who've come in and they've got problems with their erections. You then do studies looking at their arteries in their heart and find they actually have some significant heart disease, but they haven't had any symptoms yet. So it's really important that we ask about these problems. It's important you go and see your doctor about them. And then actually what you can do if you find high blood pressure or high cholesterol, diabetes, other problems, you can actually treat those problems and then reduce the risk of you developing your heart attack if they're treated. Or the medical problem could be significantly impacting the sex life. So, for example, we see patients who are really worried about having sex, having had a heart attack. And the doctor or the nurse may be happy to talk about all those heart disease risk factors, things like blood pressure and diet and smoking and alcohol and weight and exercise. But maybe the patient or the doctor may not be as comfortable talking about sex and their sex life. And as I've just shown, actually talking about your sex life can be life-saving, so it's really important. So there are a lot of studies now showing that patients want to be asked about their sex lives and about their sexual problems. They want the doctor or nurse to ask them. And actually in a number of areas of medicine, doctors and nurses are really good at doing this in other areas other than sexual health. So, for example, in diabetes care, diabetes and things like sexual problems such as erectile problems are really, really common. And the diabetic specialist nurses and doctors are really good at asking people about their problems. And there's a lot of work going on now in other areas of medicine. So, for example, in cancer care, there's lots of cancer pathways now mapping out, asking people about their sexual problems and then how they might help them and refer them on. And they've understood that their general well-being is really linked to their sexual well-being. And it's really important to ask and normalise asking and inquiring about sex and people's sex lives.
I believe in miracles. Where you from? You sex.
Now let's think about your age and how relevant that is to this question. The fact is that lots of people of all ages are having sex. About 60% of men and 40% of women aged between 55 and 64 have had sex in the last 4 weeks. That goes down to 40% and 20% if you go up to 65 to 74. But there's a significant minority of people who are having sex and are sexually active in their 8th or 9th decade. But we do know from research that older people are less likely to go and see a doctor about their sexual problems. Although there was a study recently in January of this year that showed that older men were more likely to go and seek out help than older women. So let's just think about what the reasons might be for why an older person is less likely to go and see their GP about their sexual problems. Firstly, let's think about the patient. So it may be that an older person thinks that the problems they're experiencing are normal with ageing, or that their GP isn't specialised in sex, so they're not the right person to talk to. They may feel guilt or shame or fear or embarrassment about talking about these things. Or they may feel that they don't want to be the one to raise it and they want their doctor to raise it. And if we think now about the doctor and their part in this, so sometimes doctors are not proactive in asking the patient and are waiting for the patient to ask them. We do know that doctors may be less likely to discuss side effects of certain medications that might have sexual side effects with older patients rather than younger patients. Some doctors may feel that it's intrusive or inappropriate to ask older people about their sex life. They may offend somebody. And it may also be related to training and experience, and there's not as much training in older age sexuality, and so not feeling comfortable to discuss these topics. So on a practical note, please do go and see your GP, or you could go and see a different GP in the practice if you feel more comfortable seeing somebody else. And before you go, do plan a little bit. So think about what you want to say and how you want to say it. Don't worry too much about the words you use. The doctor will be fine with how you express yourself. You might want to write things down if that's easier, and write it down before the appointment, or take that piece of paper in with you, and then you can work through and make sure you don't miss saying anything that you want to express. If you don't feel able to go to your GP, you could go to a sexual health clinic. These are local, no referral needed, open access. In fact, you could go to any clinic. You don't need to go to your local clinic. I'm based in London, and I saw a patient who travelled from Wales the other day to come to our service. Now, staff in those clinics are used to talking about sex all day, every day, and they will not be fazed by your questions. They may be able to help you with your problem, or they can certainly refer you on or signpost you to where you need to go. And if you needed to see a doctor for any of the problems you saw them about, now I don't know what your sexual problem is, so it's difficult to answer exactly here. But when you see the sex therapist, they could advise you if you actually need some medical input as well, and then refer you on. A good place to start if you're looking for a sex therapist is to go to the Relate website or the COSRAT website, that's COSRT. Now I really hope you feel empowered to be able to go and to speak to someone about your sexual problems, because there is help out there. There are treatments for all sexual difficulties, so I really do hope you go and seek out help. Thanks for listening. I do hope you check out some of our other videos, and please do send in your questions by the comments section below. Thank you.